Good afternoon, everybody. It's Dan Giancola here. We are bringing you a fantastic training this afternoon with HII, or Health Insurance Innovations. I have the beautiful Annette and the beautiful Tracy online here, and they're going to go through their powerful short term for us today. So I'm going to pass it on over to you two.
Well, thanks, Dan. As always, you're awesome and appreciate the time that you're giving Tracy and I today to speak. So I'll try to be as energetic as you are. I always love your energy. So my name is Annette Delke. I'm the Vice President of Sales at HIIQ. Been with HII going on 8 years, as Tracy has as well. Tracy is the rock star of the company, and she is my lifeline. She will be there to support you in every which way, from products to any kind of services that you do need, from claims to benefit questions or anything like that, dealing with the agent, not the client. Client, we have My Benefits Keeper to help with. So agent side only is Tracy. And Tracy, I'll let you say hi, and if you want to introduce yourself as well.
Sure. Hi, everybody. Thanks, Annette. So like Annette said, I basically support Annette internally. She gets to do the fun job, travel, and gets the external experience, so I get to handle the internal stuff. So anytime you have any questions regarding any of our products or anything you need, my number is here on the screen. Please feel free to call me.
That's awesome. Okay, so let's get started. We plan to keep you here for about 2 hours today. So hopefully you have your coffee. I am just kidding. It should be about 45 minutes, depending on how we talk. The Packers play tonight, so it might be 30 minutes. So I have to go watch the game. No, I'm just kidding. Well, they do play tonight. Go Green Bay. I live in Green Bay. So today we're going to talk about our new Aspen short-term product. There's nothing like it in the industry. As I was talking to Dan, and I said, the one product we want to start training AHCP on is the Aspen plan. Like I said, nobody has anything like this product. It's unique. It has something called the 50% pre-X allowance. That's my little carrot for you, so remember that. And we will talk about that right after we go over the benefit details. So Aspen is the name of the product. It's the name of the company, A+ rated. HIIQ is not the carrier. They are not the claims payer. They are not the billing company. The relationship between HIIQ is me and you. So that's where you will see our name. So when in the sales process, you are not indicating HII. So I just want to make that crystal clear, and that's actually a compliance issue if you are representing HII with your client, which makes sense. So when you represent NatGen, you're representing NatGen. When you're representing Aspen, you're representing Aspen. So just keep that in mind as well. So again, Aspen is underwritten by Aspen. It's a global company. Google it. You'll see how big it is. Again, A+ rated, exclusive to our agents and HII. So here's the state availability chart. There's a few more states that I'm going to show you in a little bit. It's 36 months in most states, 6 months or 12-month option, but there should be really no reason that you don't sell a 36 month because it's the same cost as a 12-month. And it's always guaranteeing them another 12 months. We do have the Pre-X rider available for extra cost that you can add, so that any Pre-X condition that that happens in the first policy will pay in the second and third policy. So that's what a Pre-X rider means. Doesn't mean any Pre-X condition that they have today is covered for 2, 3, and 4. It just means any condition that occurs in policy 1 will be covered in policy 2 and 3. And that's the Pre-X waiver rider option. When you go and quote, it'll be yes or no. And it is extra premium. So I'll give you a little second to look at the state chart. Arizona, which is great, finally is a 12 by 3. And then we also have North Carolina and Tennessee that just got approved. We are happy about that. They are also 12/3. Nebraska will be a 12/3, but we're waiting for that to be approved. So, like I said, we continuously are updating states with this product. If your state's not listed, we have the Life Shield product. Actually, we have, for you, we have, I think, Advent Health and some other products available. It all depends what AHCP is putting on your platform. But right now, Aspen is the available product for you, not Life Shield. Take that back. So, again, these are the state charts. I have to say the lovely ACA disclaimer, as we all know, it is not ACA plan. So FYI, yes, compliance wants me to say that. I am. So product highlights, multi-plan PHCS for doctors, and for the hospital, it's 150% of Medicare allowable charges. The reason we did that, if you sell over 65, 95% of hospitals accept Medicare. So the simplicity is there, where some networks you have to, okay, do you accept this network? Do you accept that network? Do you accept Medicare, reimbursed 150%? The discounts, I've seen 85%. I've seen them so significantly large. So the happiness is there. And the clients won't be balance billed. So if for some reason the hospital is not accepting that, our TPA and carrier will work with that doctor. So you don't have to worry that the client will ever be balance billed. We did get that guarantee. So again, the doctors is multi-plan, the hospital is Medicare allowable. The unique thing with this network is if you go out of network, does that mean there's no coverage? Like some of the carriers out there, if you go out of network, there's no coverage, and that is really actually scary if you ask my opinion. With us, you have the same benefits. You have your copays, you have your deductible and coinsurance. You just won't get the network repricing, and you could be subject to your usual and customary charges. But again, you have normal coverage, no penalty, no double the deductible, triple the coinsurance, or anything like that. So huge selling point with the Aspen short-term plan. Another thing that is great, let's say that somebody, which Tracy will talk about, is wellness. So for example, wellness blood work isn't covered, mammogram isn't covered, but they will get the negotiated rate if they go to a network provider. We still want to give them a discount for a procedure or something that's excluded. So that's another great selling point. Doctor office visits, we have $25 in limit, $40 in limit. We have a wellness visit of $50. Deductible options range from $1,000, $2,500, $5,000, $7,500, and $10,000. We have coinsurance options. I know my understanding is your organization likes that 100%. We do have that as well. 80/20, 70/30. Out-of-pocket ranges $2,500, $5,000, and $10,000. So if anybody says to me, your price too high, I'm going to say, did you play around with the deductible? Did you go higher, coinsurance? So you can't tell me that you don't have options with us. So choice of coverage period, next day coverage. How great is that? You can write a policy today, effective tomorrow. We're all happy with that. You can do delayed applications. What is delayed in that? Delayed means that someone doesn't have the money today, payday in 2 weeks. That's fine. You can do the delayed draft. You can do it up to 89 days. If you do that, that means you're super lazy and you can't get the client's money. You can't get that commitment. My suggestion to you, sales tip number 4 so far probably, don't do a delayed app longer than 2 weeks. That client's pushing you off. That client's trying to get you not to make that sale. You want to get that money because we pay on issue date. We don't pay on effective date. So as soon as you get it issued, you get paid. That makes us all happy. There is a 5-day wait. Sorry, my voice is lots of webinars this week. 5-day wait for sickness, 30-day wait for cancer in most states. Some don't have that. If you do the Preex waiver rider, period number 2 and period number 3, that would, of course, be waived, which obviously if someone comes down with cancer in the first policy, the second policy would not put another 30-day wait for cancer, so which makes sense. All right, you're probably sick of my voice already, so we need the beautiful Tracy, and she has the Vanna White voice. We'll be talking now. Everybody knows how to read a brochure, so she won't go line for line, but she, in a sales way, is going to make you understand what you should sell for your client. Obviously, we have the Toyota Plan 1 to, I don't know, a Lamborghini on Plan 3. I'm a big fan of Plan 3. It's going to cost more, but you're giving your client a really benefit-rich plan. And Plan 3 for a family, you're going to want to do that. I know you're owned by NatGen, so you sell NatGen's ancillary. So if you're selling these policies, you better be selling ancillaries, especially with Plan 1, because it has some holes in it. Plan 2 is definitely much better, but if someone doesn't have any money, you're going to look for Plan 1. So I'm going to be quiet now, and I'm going to let the great Tracy talk. Go ahead, Tracy.
Thanks, Annette. Okay, so Annette already went over your plan deductibles and your coinsurance options and your maximum out of pocket. So what I'm going to do is I'm going to talk about the additional deductibles in this section. And if you look, the easiest thing to remember is on Plan 3, it is a true traditional short-term medical plan. So the difference between Plan 3 versus 1 and 2, when we're talking about additional deductibles, when you have outpatient surgery, there will be that $500 additional deductible per surgery on Plan 3. They do not charge that on Plans 1 and 2. The same thing for emergency room and advanced diagnostic studies. And the reason is because the benefits on Plan 1 and 2 are a little bit different as Plan 3 is your traditional plan. So just keep in mind that it is additional deductible to the core deductible for those services on Plan 3. Next slide.
Sorry, my system's slow today.
Okay.
Or maybe
All
it's just me.
Yeah, maybe. It's been a long week. Okay, so this is where the plans get a little bit different. When you're looking at Plan 1 on your doctor office visits, you will see that it's a $40 copay to a maximum of 3 visits. A lot of agents will say, what happens if my client needs to go for a 4th visit because I'm on a 12-month plan? That 4th visit and beyond would be subject to the plan deductible and coinsurance. Same thing on Plan 2. The good thing with Plan 2 is it's a $25 copay per office visit for urgent care or primary, specialist as well, and that is unlimited. So Plan 2 has a very rich doctor visit benefit. Plan 3 is going to be your $40 copay per visit. There's no limit to that. All benefits then, all office services will then be subject to your deductible. Your deductible and coinsurance are waived. The wellness benefit. So it's $50 copay across the board on all 3 plans. And what the wellness benefit covers is the actual routine physical. So when I go to my primary and I get my height, my weight, my blood pressure, he does all that great stuff. That is my physical, and that's what I'm going to pay $50 for. All other charges for that wellness benefit is then paid by the plan at 100%. When Annette was talking earlier about mammograms, pap smears, those sort of benefits, those are state mandated and they really fall under a preventative type service. So depending on the state, those services may be covered. Some states they're not. So the wellness, keep in mind, is only for the physical. That gets a little confusing for consumers. Advanced diagnostic studies. Plan 1, you'll see it's subject to your deductible and coinsurance, the same as Plan 3. We have highlighted Plan 2, where if I'm going in for an MRI, CAT scan, PET scan, something of that nature, it's an advanced test, I'm going to pay a $500 copay per occurrence for that diagnostic test. The rest of the charge is going to be subject 100% towards the coinsurance. So that is a great benefit, again, when you're looking at Plan 2. MRIs can be expensive, PET scans, CAT scans, so that may be something that your client is interested. So Plan 2 would be a great benefit for that. Next slide. Okay, so this becomes the meat and potatoes of our plans when you're talking inpatient and outpatient hospital services. Plan 1 and Plan 2 have limits to what they will pay out for your standard room rate per day if somebody is admitted inside the hospital. That is going to include all nursing charges and miscellaneous charges. If you look at Plan 1, the plan will pay up to $1,000 per day for that room and board charge. Anything in excess of $1,000 per day is deemed beyond the policy limits and are not considered eligible expenses. That $1,000 a day, as well as Plan 2 up to $4,000 a day, is not a cash benefit. Those benefits will be subject to the plan deductible and coinsurance. But that's the difference between Plan 1, 2, and 3. If you look at Plan 3, it's the average room rate. So whatever they charge for that room rate, if they happen to be in, in a city, Dallas, Texas, and the room rate is higher, then Plan 3 is going to pay to that actual room rate. Same thing with your intensive care unit. Plan 1, it's going to be $1,250 per day. Plan 2 is going to be $4,000 per day. Plan 3 is going to pay whatever those room charges are. Inpatient doctor visits, it's $50 per day, not to exceed $500 per covered person per coverage period on Plan 1 and 2. That means when if you're admitted into the hospital and your primary doctor comes to see you, or your gastro doctor or your cardiologist, they will come see you, they will bill the insurance company. Plans 1 and 2 will pay $50 per day for those doctor visits. Plan 3, whatever they charge, reasonable and customary or reprice, will be subject to your deductible and coinsurance. Emergency room. When you look at Plan 1 and 2, and this is where Annette was talking about ancillaries that you write on top of these plans. If you're going to write Plan 1 or 2, please keep in mind that the emergency room benefit on Plan 1 as an example, and this includes all professional facilities services, miscellaneous services, it's only going to pay $250 per visit. It's not a cash benefit. Again, if the first time you've used a plan, you end up in the emergency room, you're on Plan 1, that $250 will go towards the plan deductible. Anything in excess is deemed beyond the policy limits and would be the responsibility of the consumer. Plan 2, same thing, but it's up to $500. So Plan 2, you're going to get a $500 benefit, again, subject to your deductible and coinsurance. Plan 3, I go to the emergency room, my bill is $1,500. Plan 3 is going to pay that, all eligible expenses subject to your deductible and coinsurance. So that's why on the earlier slide you did not see that additional deductible on your emergency room. That is because Plans 1 and 2 limit what they pay out for emergency room services. Outpatient hospital services. The outpatient surgical facility. So, and keep this in mind as well, somebody can go to a hospital, and if they have an outpatient surgery, even at the hospital, because it's going to be deemed outpatient as an outpatient surgical facility, Plan 1 is going to pay up to $1,250 for that benefit. So if I go to the hospital and I have a day surgery, and I get discharged that same day, Plan 1 is going to pay up to $1,250. Again, all eligible expenses subject to deductible and coinsurance. Plan 2, if I'm on Plan 2, same benefit, up to $2,500. Plan 3, subject to your deductible and coinsurance. And then your outpatient miscellaneous hospital expenses. Again, the benefit payable for miscellaneous outpatient hospital expenses. This does not include the outpatient surgical benefit, but this benefit is limited to $1,250 on Plan 1. On Plan 2, it is up to $2,500. Plan 3, it's the benefit for all miscellaneous outpatient services, excluding surgery, will be subject to your deductible and coinsurance. Surgeon fees, assistant surgeon fees, the administration of anesthesia, all of those benefits, again, Plan 1 is going to limit what they pay the actual surgeon. $5,000 per surgery, not to exceed $10,000 on Plan 1. Plan 2 is $10,000 per surgery, not to exceed $20,000. And Plan 3, the surgeon services are subject to your deductible and coinsurance. So again, keep in mind, those are Plan 1 and 2. Those services are subject to your deductible to that policy limit. Assistant surgeon and surgical assistant, they're going to get $1,000 on Plan 1, not to exceed $2,000, and on Plan 2, it's $2,000, not to exceed $4,000. The administration of anesthesia, Plan 1 is $1,000, not to exceed $2,000. Plan 2 is $2,000, not to exceed $4,000. And then when you get to extended care facilities and your home health care and your hospice, those benefits are going to pretty much pay the same across the board. And you can see the different benefits, 150 per day or 50 if it's home health care. Hospice is 2,500. So those benefits are going to be the same across the board.
The next slide. Oh, sorry, just to jump in.
Yeah.
So the next slide, so we don't have to poor Tracy. She's a little under the weather today. She's feeling kind of sick. There's limits on these certain type of surgeries, etc., which the brochure does go over all of these. So these are listed on the brochure, so you can review those. But I think the next slide, which Tracy deals with claims and a lot of questions and experiences talking to agents. A lot of questions she gets is the mental disorders and the substance abuse. And it is a selling point because some of the plans out there don't have any coverage for this. So Tracy, if you want to just go over the differences between plan 1, 2, and 3 on those.
Sure. So mental disorders, we do get a lot of questions. A lot of people go to counseling. A lot of people, may go to a psychologist or something, and agents call up all the time and want to know what mental disorder benefit is. So keep in mind, first of all, they have to be diagnosed within the plan, and it has to fall under the definition of a serious mental disorder. The benefits will pay across the board, plans 1, 2, or 3. You're going to get inpatient mental benefit of $100 per day, 31-day maximum per coverage period, per coverage person. Outpatient is going to be $50 per visit, 10 visits per covered person, and that's the same across the board on all 3 plans. The same thing with substance abuse. We get a lot of calls where people are looking to go either inpatient or outpatient for substance abuse. Again, it's got to be a diagnosis within the plan for this benefit to pay out. And again, it's going to be $100 per day, 31 days inpatient, and outpatient services is going to be $50 per visit, 10 visits per coverage period. And keep in mind that every coverage period, so every 12 months, these benefits do reset.
Awesome. Well, thanks, Tracy. Appreciate your knowledge as always. You're wonderful. So the eligibility, what's great with this one, it comes with a child only. I'm part of a lot of chat groups, and I see questions, what plans have child only? You can put multiple children on one application, oldest child first. It can't be newborn, it has to be ages 2 to 17. So along with that, you can have family, you can have a newborn, that's not a problem. It's just saying child only, ages 2 to 17. Medical questions, I'm not going to read this word for word because I'll probably have all of you drop off the call on me. But the main points of this plan are 325 pounds for male, 275 for female. It's not a height chart. We take someone that is a diabetic, diet controlled only. Again, diet controlled only. What happens a lot is after Tracy and I do this presentation, she'll get a call. Well, what if they take metformin? No, diet control only. No any kind of meds, but at least we'll take someone that is diet controlled only. Another thing is basal cell skin cancer. Someone who has had basal cell skin cancer, we will take them. Obviously, it's pre-existing, but at least we will take them. We don't require Social Security numbers, and hopefully Dan is not recording this presentation. We'll take all the illegals out there. I am kidding. I mean, all the illegal aliens. No, they have to legally reside in the U.S. During this policy. So we don't require Visa, MasterCard, anything like that. Just kidding, but no social required. Okay, so this is where I get really excited. Is the pre-existing conditions allowance benefit? Nobody has this. So, what is the biggest headache? If you guys weren't on mute, I would ask you, what is the biggest headache for all of you when dealing with short-term insurance? Client has a sniffle, client has high blood pressure, client goes to the doctor, and then what happens? Ask Tracy. She deals with claims. Medical records are ordered. It's just a doctor's visit. They just want their office visit claim paid. That's it. But doctors hate medical records, so it takes months to get, and then you have ugly and angry clients. What this is this is actually something I am going to read right off the screen for you. Pre-existing condition allowance benefit means any eligible, again, eligible, so not like a corn or something that's excluded on the policy, cosmetic surgery, etc. Eligible expenses related to pre-existing conditions will be paid up to and no more than 50% of the plan's deductible per coverage period. Do I have your attention? Deductibles and coinsurance payments for all of any eligible plan benefits are applicable to this benefit. However, of course, payment of this benefit does not in any way affect or waive any of the exclusions or limitations, which makes sense, but not always to some. Once the plan has paid the amount of up to 50% of the plan's deductible, the consumer is responsible for all claims related to that pre-existing condition. So let's look at a true EOB that was processed. So, key component, cardiac testing. What usually would happen when someone would do cardiac testing? Medical records would be ordered, right? Well, it didn't happen here. And the great thing about it is date reported 8/26, right? So the claim services was 8/5. It was already processed. So quick turnaround time there. So we got happiness first. So bill charge is $325. Look at that discount of $225. Eligible amount $99.58. Member responsibility is $25, so they have plan 2. They have a $25 copay. So the plan responsibility is $74.58. So then we have the bill charges again for a test. Discount of $32.50, $17.50 go towards the client's deductible. Bill charges of $45, discount of $12.41, $32.59 goes towards the client's deductible. So the member's responsibility is $75.09 of a $420 bill that may have deemed pre-X, but because it's under the member's 50% of the member's deductible, no medical records were ordered, yay, and it was processed to the benefits of the plan. So keep that in mind. So if you have a client that goes once a year for high blood pressure, which you know is pre-X, they can use your office visit copay, and there's a lot of happiness there. So what happens is the total amount of this bill after discount goes towards that allowance. So that total eligible charges after discount of $149 will go towards meeting that pre-X allowance. So keep that in mind. So this plan is amazing. I couldn't be more happier than a plan that's ever come out with our company. So if you were thinking clearly with your client, you would sell a higher deductible for someone that has pre-existing conditions. So you'd want to maybe sell a $10,000, so they have $5,000 in a pre-X allowance. Okay. So once they hit 50% of the allowance, what happens when claims are over that? Pre-X investigation would be done, and if it's deemed pre-X, we wouldn't pay anymore. They would still get a negotiated discount on any of those claims if they go in-network. So that's a great selling point as well. This plan is a 24-month look-back for pre-X, and again, what I discussed with the 5-day wait. My lovely EOB that I love. How will consecutive policy terms work? So we have 6x6, 12x3, 6x3. So what happens is they get a hard card in the mail. We still do hard cards. Some carriers don't. They get a plastic pretty one. We love it. That's the same card that they use for all policy periods. After the first one is up, they will get an email with their new premium if applicable. They get new business rates. So if it's taken a trend increase, etc., they will get that rate. If they do not want this policy, they will have to call and opt out. It's automatically renewed. Okay? So that's what's great. No medical questions. They don't have to answer any of that. So if you don't sell the pre-X rider buy-up, they still are guaranteed another 12 months and another 12 months. It's just that anything deemed pre-X in the first one, if they come down with cancer and it's over the 50%, that just wouldn't be paid. So keep that in mind. Single payment, monthly payment, we do not take yearly upfront payment, only up to 30 to 180 days. So we have the PHCS and, which I discussed, the facility charge. We have the association plan, single care RX helpline. We have the CARES 360, which everybody knows about. Claims of $2,000 and higher, they're deemed pre-X. I've seen a $95,000 bill rate priced down to $50,000 to help find doctors. There's patient advisors just to help these clients. It's something like I've never seen. Like, I'm sure you guys are on insurance websites and work with other agents. And what do you see? I have a client that doesn't have insurance. Is there any kind of CARES 360 or patient advisors that can help negotiate these claims down? You see it over and over. This plan has it built in, so it's great there. Teladoc, $10 one-time setup fee. Especially with that 5-day wait for sickness, you have Teladoc to overcome that. So it's perfect. RX card single care, 45% off on retail, 80% off on generic. That continues after the policy terminates. They get a hard card in the mail. It's a no-brainer. Now, My Benefits Keeper, there's an app for that. You actually get a desktop or a mobile device. So when they call into the company, they're calling into My Benefits Keeper. So it's answered My Benefits Keeper. The emails are My Benefits Keeper. So you don't see HII anymore. That's what's going to show on their billing statement. It's My Benefits Keeper, Keeper of Benefits. That's where they go to print their ID cards if they need to print them right away. 7 to 10 business days, they get hard cards in the mail. They track their benefits. They review their payment, update their payment information. It's just a really great site. This changed this year. We spent probably a good 2+ years creating this website and changing everything. It is so amazing. Now, so obviously to get contracted, you have to contract contracted call AHCP. So one thing, once you become contracted, you will get a user ID and login to your HII website. Under sales materials, this is where you will see ASPEN, which you can write, and all the information about the product. So the PowerPoint, the sales aid is all out there. So anything to do with your billing, your reporting of your policies, all of that information is out there. Real quick here. I'm going to bring up, seeing we are great on time. You will, once you're approved, you'll get a link for ASPEN. There's actually the PowerPoint and a test that you take before you can sell it, but that's actually a good thing. You're like, a test? But it helps you review the policy, helps you review the product. It's pretty simple. You can take it as many times as you need to pass it, so no big deal. Everything I talked about today, multi-plan PHCS to look up a doctor, definitions, which, if you need to know, benefit details, all that, about the product, everything we talked about, single care, if you need to look up a prescription, CARES 360, RX advocacy, everything is out here. Again, this is a test link, but I still wanted to show you. I'm going to do Wisconsin because I have that memorized. Let's do tomorrow. Here's a spouse if you want to do. You can compare plans right here, right at your fingertips, everything Tracy talked about today. This is what I was talking about, the pre-X rider, yes or no. That is the buy-up to give them continuous pre-X coverage from policy 2 and 3. It's going to cost more. okay? But you don't have to purchase it. The pre-X allowance is built into the plan. So let's do so you can do a 6x3 in Wisconsin. Why wouldn't you do that? Whoops, see? You can't make a mistake. So any kind of ancillaries that are available will be on the left. So you can, again, compare plans right here. You don't have 125 pet benefits. That's just a test. Plan 1, 2, and 3. So it's nice. You can keep it simple, stupid is the word. $7,500 deductible. There's your 100% coinsurance. Your million lifetime max. 750,000 you want. So you can just play around with it. All that. Let's do apply now. No. I'm healthy as a horse. Healthy as Aaron Rodgers. You better stay healthy. Okay, so let's just do let's do Dan Mac. I wonder if I've done Dan Mac. Oh, I'm gonna do him. I remember 5 feet, 14 pounds a day. Now, when doing an application, you either need their cell or email address. Verify. It's verified. This is where you do the delayed application if you want to do future payment, not right away, but I don't. Billing date is always 30 days. This is where you can text for signature. Along with that, any kind of payment updates. You can also text the ID cards to the client, which is super unique. Client gets their ID cards immediately after the application. We do list bills of 5 or more. So yes, let's do it. Call me. I'm happy with that. Oops. See? Keep it simple, stupid. There we go. We do allow screen sharing, but at the end, you cannot turn over the mouse. You have to email them or text them because it shows their IP address. All right, let's see if I can get this text app to work. If all goes well on my day today. Let's see. I accept. Of course, you accept. View these clients. Your clients will get all these disclaimers in the e-signature part. So when you're doing the application, you're never going to see the agent signed app part. We remove that because it's open to too much confusion. Enrollee signed application, this would be if this link was on your website or if you emailed your link to the client and they were doing it from start to finish. If you're doing screen sharing and you turn the mouse over and they click on that, you're totally out of compliance. You can't click this if you're doing the application. Never. You're completely out of compliance. And we show IP addresses and you're going to get a call from our compliance people. So we don't want that to happen. So you always do send for Adobe signature. So with this text message, they will always get an email and a text message. So we want that to happen because if something happens, then you know that you can go to email, etc. If I do text message, and a box is going to appear that says don't close it. Now, Tracy, are you still there? Because I know you weren't feeling good.
No, I'm here.
Okay. So what happens if they don't sign it right away? You have like 48 hours. So you see where it says signature pending? Usually I tell you to close the deal right then and there. But if for some reason the client doesn't sign it right away, they have 48 hours. Do you want to talk about that for a second?
Sure. So they have up to 48 hours to sign the application. What's going to happen, though, is once they sign it, the payment will not go through because we've closed out that payment line because it's an open line. So your client, you're doing it today, your client goes home tonight, signs the application, that's not a problem. You're not going to see anything in your back office. You're going to call the next day and say what happened. We can then push the payment through. We do that for security reasons, so we don't want to leave that payment line open. Once the payment is collected, policy goes into effect, member gets member welcome email as well as you. So they do have up to 48 hours, and then we can push payment through.
But you have to call. So if you see that the client hasn't signed
Correct.
it, then that's when you have to take control and call in to make sure the payment gets pushed through. So you always want to try to, thank you, Tracy, you always want to try to seal the deal and get it done. But we know sometimes clients aren't there, etc. But you know, because you always get a welcome email, or you could check your back office and it shows that it's not showing up. You know there's an issue. So you see that I got that email right away. And you see right here, it's still open. No big deal. That makes me happy. The client's opening it. Keep it simple, stupid. Start. Right here, you click on it. All you have to do is type Dan. I know I didn't use Dan's name lately. I've used so many people's name and it'll reject if it's the same policy. So that's all you got to keep hitting doing is next. A lot of times clients say, well, I signed it. No, a lot of times they don't finish every step. See, like you saw that I didn't take the pre-ex waiver rider. I declined it. And click to sign appears in the bottom right. Now it's preparing. And if all goes well, this is going to switch to complete. Sometimes test applications act funny. Ooh, signature complete. We're happy today. Now, a box is going to appear to enter agent information. Maybe. It might. Oh, it didn't. Yay. Oh. It might. Yeah, this is just because of it's a test. It doesn't normally do that. Again, just because it's a test and it's a test link not tied to an agent. So don't worry, you don't have to do that. And what will happen is you'll get bounced right to this confirmation process. You see? Boom. This is a copy of, what happens is the client will get a copy of all their applications. It says filed. That doesn't mean it's approved. They get a welcome email once it's approved. Should be pretty immediately. I put everything to all my welcome emails to delete. So here's the welcome auto. Data. Payment. See, payment receipt. You have little pictures here, but it's not. Oh, here we go. I just want to download the picture. There we go. All right. Pretty little family. Your coverage is effective. The state. Here's your policy number. Account setup. They can set up My Benefits Keeper. Because if it's additional policy, they may already have them. MBA, the account, App Store, Google, understanding your plan, what's covered, what's not. They can find a doctor right there. It's a video on how to do it. All claims is Allied. Billing, customer service, My Benefits Keeper, 10-day free look. Opt in, opt out. So this is a pretty welcome email that you get CC'd in on it. As you can see, payment receipt went through and you got the welcome email. So it's pretty simple. All right, we are done. I wanted to show you an application process. You can get appointed through, again, AHCP, give them a call. They'll send you an online link to get appointed. There is a couple tests you have to take, and then you can get happy selling. I don't know if we have any questions.
Let me check for you. Great job as always. First off, ladies, you did amazing.
Thank you. Thank you. Hopefully you
doesn't look like
made people laugh.
Only thing we have on here is that they hope the Packers lose. That's all I've gotten through here for you.
Well, that person needs to be disconnected. Click. 4-0 tonight, baby. Come on now. I love it.
Doesn't look like anything came through. Well, guys, if you have any questions, oh, the Bears. That's all. That's what you got.
Oh, that's why. Oh, all right. Well, wonderful. Like I said, if there's any other questions after the webinar, I can pull up Tracy's information again, or Dan has it too. I again appreciate the opportunity that you've given us today, and look forward to building this partnership. Again.
Awesome. Well, thank you. You too. If
All
anybody
right.
does have any questions, oh, there is one that would quickly pop through if you would.
Sure.
Explain the PEP $125.
No, that was a test app. The PEP fee is an enrollment fee, and yours is in 125. I'm actually unsure. I think you might be 75, but 125 is a different. It's just a test. You don't have you guys have a $75 PEP fee. It's either 50 or 75. I'm unsure, and it is refundable if they choose within the 10 days of the effective date. Dan, I'll look what it is. I'm just not sure, and I'll let you know. I'll shoot you an email.
Perfect. Then I'll shoot it out to everybody who participated today. If there is any additional questions, you can always feel free to reach out to Tracy there, or of course the training box here at ahcpsales.com. And you know what, everybody, thank you for your time, and thank you so much, ladies.
Thank you.
Thank you.
Bye-bye.
Thanks.
Bye, everyone.
Bye.